All right, in this week's Kara's Cure, we are discussing something that can make Scott very uncomfortable.
It does.
Breastfeeding. Specifically, breastfeeding at work.
No, well, I saw a woman breastfeeding on the train, Amtrak, going to Washington, D.C., and
That's her right, actually. I know, I'm a little modest, but...
She just kind of whipped it out, and I was like,
okay.
Oh.
Now, many moms, especially those who are into holistic health, really want to breastfeed their babies for as long as they can, and they think there's no way to do it when they get back to work, or they wonder how they're going to juggle. So today, we talked to a Hartford Hospital doctor who shows what working moms needs to know. Dr. Kelly Johnson Arbor helps patients with wounds that don't heal get better in the hyperbaric chamber. She manages life or death emergencies and still manages to breastfeed 4-month-old Mason. And you are managing to exclusively breastfeed him even though you're this busy emergency doctor.
It's tough, but you can do it.
She says she does it to keep Mason healthy and happy. Can you say Channel 3? Can you say Better Connecticut? Can you say Scott Looks like it's working. So what are some of the challenges you've overcome?
So the first thing that I noticed when I came back to work was just it was really hard to manage time. I mean, you're busy, you're seeing patients, you're running back and forth, you have meetings, and you can't really say to your patients, I'll see you in 5 minutes or 10 minutes because I have to go breastfeed. So what I had to do was I had to really balance my time really well. So no more surfing the internet, no more, sitting here waiting for patients, nothing. Any free time that I have, I pump, basically.
During a busy day, it's hard to keep track of ounces and minutes of pumping. So yes, there's an app for that.
My husband, he found me an app called the Baby Timer, and for the iPhone, and it times the feedings, and so you can use it at home when you feed, you can use it at work if you have to pump. It'll give you the time that you've spent feeding on each side or pumping on each side, the amount of ounces you can put in. It'll tabulate it all for you.
Every minute of the day counts.
So I figure that I have to have an extra hour a day to pump, and I have to make that time up. I have to, sometimes I work from home, sometimes I'll do charts at home, I'll make phone calls from the car. I mean, you have to, nobody wants to hear that you can't do stuff because you're breastfeeding.
Especially, the doc says, in a male-dominated work environment.
I work with 2 male physicians, and they know that I breastfeed. They made a couple comments in the beginning. One of them made a comment about how he might mistake the milk for something that he could put in his coffee. So right away, I was mortified. My female colleagues, the secretaries, the nurses, the techs, they were very understanding. They said, you know what, we will help you. We'll make the signs for your door. We will find you a fridge that you can use. And they were actually the most helpful people around here.
Why are you doing it?
I think it's so much better for the baby, for their health. I was breastfed, and I don't get sick that frequently. And I've just, even when I was pregnant, I always knew that I'd want to breastfeed, and I would not let anything stand in the way of it.
Experts agree.
Women who breastfeed tend to have less days out of work. The babies, they're better health, and the baby's in better health.
Lactation consultants like Francie at Hartford Hospital say women who want to nurse need to know the law is on their side.
I think some women feel they don't know what their rights are, and they're afraid to ask the boss, hey, where's a place I can go pump?
Right. Well, fortunately, we live in a state, Connecticut is one of the 24 states that have a law that say you must be able to pump at work, that you must have a place that is suitable for pumping and ample time for pumping, which is about 15 to 20 minutes.
If you have a good electric pump, that'll be enough time. By the way, it must be a clean place, and bathroom stalls don't count.
Do you find that women have a tougher time expressing milk because they're worried about being in the office?
That's actually a really good point. Yes, if you are stressed in any way, you don't express as much milk. So, they even have tapes that you can listen to calm you down about what you're doing is a good thing for your baby, and it helps you actually express more milk. But it is a factor.
Dr. Johnson Arbor looks at baby pics while she pumps, and even brings in Mason's onesies to smell.
I think the more that you do it, the easier it is, and the more that you get into the routine. And so right now, I couldn't imagine not doing it, to be honest.
It's fascinating. No, I don't get the whole thing and how we
You just don't know how it's done, and yes, well, you don't need to. But actually, this is something, breastfeeding can save a lot of money because on average, formula costs about $1,200 to $1,600 a year. So experts say the sooner you go back to work, though, the harder it can be because your baby eats more at first, so you'd have to pump more. The bottom line, just talk to your boss. I know here in our new building, they created a lactation room when we moved here, and as you just heard, the law is on your side. It is your right to pump at work, and we have the laws for you and for your boss if they want to see them right up on the website, WFSB, or betterct.com.
Pump away. We'll be right back. Twice Big Twins are here.